Hi everyone, and welcome to day 1 of week 9. This week our main focus is going to be on medical emergencies and assisting in those situations. So for this week we'll be focusing on chapter 43. This week we're also going to have a guest speaker on both days, day 1 and day 2. This person is going to be coming from Heart Solutions, and she's going to be teaching you guys about CPR and first aid. So by the end of this week, you will be certified in both of those areas. So like I said at the beginning of the video, Chapter 43 is going to be focusing on medical emergencies and your responsibility in those times, in those situations. As a medical assistant, you will need to have some special training in these areas to make sure that you are prepared for whatever may come at you. Anytime there is some sort of an emergency, the physician should always be notified immediately. Regardless of the size of the emergency, they need to know what's going on. But there may be times that you need to contact more than just the physician, and depending on the severity, you may have to call some emergency services, such as emergency medical responders, or EMS, emergency medical technicians, or advanced medical technicians, or in really severe cases, you might have to call the paramedics. So when we start discussing medical emergencies, we need to know and we need to discuss the Good Samaritan laws that follow that. This isn't the first time you've heard me talk about the Good Samaritan laws and bring up this topic. We did discuss that a little bit, I believe it was in week 1 or 2, where we were talking about this as well. But we're going to go a little bit more in depth with Good Samaritan here. So the Good Samaritan laws were established to encourage healthcare professionals to volunteer their services in emergencies without fear of financial liability to the patient. So, for example, you are doing CPR on someone and you crack their rib. You are not liable to pay for that because you are helping under the Good Samaritan law. This rule and this law generally is going to apply not only to inside the clinic, but outside the clinic as well. Now, it is not your responsibility outside of the clinic, but if you have those services, it's nice to step up and help someone. As a medical assistant, you really have 3 primary legal responsibilities in an emergency. First is a duty to act within your scope of practice. So remember, you are accountable for yourself, your employer, and the public health. If you know that it is outside of your scope of practice, don't do it. Second, you have to ensure and document the constant emergency readiness of your office in which you work. So constantly making sure that you are up to date. You're changing those. You're making sure that they are the most accurate for the time being and not just working off of old ones. And third, you have a right and a responsibility to do all that you can to prevent the emergencies in the future. So creating those readiness plans, making sure that you know the exit strategies and how to get out of certain situations if that does occur, and stopping it from happening in the future is your responsibility as a medical assistant. There are some guidelines for providing emergency care. As a medical assistant, you must stay up to date with all of the emergency plans in your office or your facility and your community. You also need to be able to handle emergencies that come in 3 main types of situations. You can have them over the phone, near the medical office, or in the medical office. Now, when we talk about situations that will happen over the phone, it's probably the most common way that you're going to get medical emergencies is going to be over the phone. This is where your triaging skills will come into play. And what triage means is that you're going to assess and prioritize the emergency care that's needed by your patients. And you're going to put them in order of most needed to least needed. Every doctor's office will have an emergency crash cart that's available for all situations as well. This crash cart will contain supplies that may be needed during an emergency, and it will be instantly accessible to anyone in the medical office. Now, the crash cart will always have a medical drug box near it or on it, because sometimes you're going to need medications right away for certain emergencies. So some of the medications that you might see in this drug box are activated charcoal, Benadryl, epinephrine, insulin, lidocaine, nitroglycerin, or some normal saline. Now, there are other things and other medications that will be kept in there, but those are the most common ones. All right, let's start talking about some of the fun of medical emergencies and some encounters that you might have. Now, because Heart Solutions is coming to our class to teach you guys about CPR, I am not going to discuss it in the video. I'm going to let them take care of that for you. They do a great job, and it will take up our entire class period, so I'm going to let them kind of take that role this week. But some of the other things that you might experience are respiratory distress. So this could be a reaction from a long-acting disease, such as COPD or asthma, but it could also be due to an emergency situation. Maybe they have an allergic reaction to a medication, and that could be anaphylactic response. Your job as a medical assistant will be to recognize the signs and symptoms that accompany that and knowing how to act quickly. So if your patient starts showing some signs and symptoms of acute anxiety with some gasping breath, maybe they have bradypnea, which is going to be that slow breathing, generally less than 8 breaths per minute. Maybe they have cyanosis, they're starting to turn blue in color. They have a failure of their chest to rise and fall, or some nasal flaring. Or it could be the opposite end. They can have some really noisy, rattling breathing. And tachypnea, which is they have some rapid breathing because they're taking little shallow ones, and that would be something that over 24 breaths per minute. Now, you as a medical assistant, if you see any of these signs or symptoms, the first thing that you should do is administer oxygen to the patient to help them get on a regular breathing path. You may also experience chest pain, patients calling with chest pain or patients appearing with chest pain. So heart attacks are the leading cause of death for both men and women in the United States. As a medical assistant, you need to know the signs and symptoms of this as well. So the patient could have pain in the left or middle side of their chest. Most of the time you'll hear it described as a sharp, stabbing, crushing, squeezing, or aching pain. But this pain may also radiate from that area to the left arm, up the back, and up the neck. Okay? Now, if you have any of those symptoms, the first thing that you should do is call 911. But what happens if your patient calls you and they're at home and they call saying that they're having chest pain? First and foremost, never hang up on your patient. Never tell them that you're going to call 911 and just drop them from the phone call. It's always important to stay on the phone with your patient. Have a coworker actually call 911. Tell them where the patient is. Tell them the patient's name. Tell them the symptoms that they're having. And you stay on the phone with that patient until EMS services do arrive and take over care. That way, if something does happen, EMS can pick up the phone and talk to you as well. Okay? And the last one that I want to talk about for today's video is going to be shock. Shock is where you have a collapse of your cardiovascular system, and it's really caused by an insufficient cardiac output. So your heart's not putting out what it needs to. Again, you need to know the signs and symptoms of this. First and foremost, you're going to see patients will have some weakness. They'll have a rapid heart rate, increased thirst. They'll have cool or clammy skin, a lot of confusion. They may even go unresponsive, and then they'll also have some nausea with that as well. All right, guys, so it's going to be a a jam-packed week with Heart Solutions coming in, so please come prepared for class. Please try to arrive on time, as she will need pretty much the entire class period, both days, to help us with first aid and CPR. Have a wonderful week, guys, and I'll see you on day 1. Bye now.